the U.S. is going to need doctors, and a lot of them over the next decade. Our population is aging, but is healthier and living longer. And as a result, physician shortages are being felt across the United States. Our Kate Rogers is live in Arizona. She has more on the story. Kate.
Hi, David. That's right. The Association of American Medical Colleges projects there could be a shortage of up to 122,000 physicians by the year 2032. That's in both primary and specialty care. We're here in Arizona. The state is currently short about 600 primary care physicians, a number that will triple in the next decade. The state is 44th in the nation for its ratio of primary care physicians to population, and that matters because the population here is growing very quickly. One way to fix this issue is by adding more residency opportunities for doctors like Christopher Liu, who's a first-year resident here at Abrazo Health, which recently added 2 new residency programs for both internal medicine and general surgery.
So we've got a significantly large elderly population, so with that come a lot of chronic diseases, such as cardiovascular disease, diabetes, high blood pressure, those type of things, and managing those diseases and the complications that can arise from those.
The hope here is that the more residents like Dr. Liu who come to states like Arizona to train will wind up staying here once their program training is complete and do this very important work and hopefully fill that doctor shortage gap. Mike, back over to you.
I just have a question, Kate, on why this is happening and how much you're hearing about the economics of being a doctor and how they don't get paid as much and it's much more challenging, and how doctors always complain that times are very different and the cost-benefit ratio just isn't what it used to be.
Certainly, Sarah. So student debt obviously is a huge factor. The cost and time and the way that the job is done now that technology is much more involved has also changed, the day-to-day duties, but also the aging population. There are more Americans who are living longer because they're living seemingly healthier lives. They need more care as they age. And also a lot of doctors are hitting retirement age, so they're leaving the workforce. So that aging population is kind of slicing the industry in several different ways. And one more thing, the AAMC says more residency programs and slots actually need to be added. So they support congressional efforts to increase the amount of Medicare funding that goes into those residency training programs because the hospitals wind up bearing a lot of the cost to train these physicians as they go through their careers.